This is Nolan Arbol, the very first person to receive a Neuralink implant, playing chess using nothing but his mind to move pieces. It might sound like something out of a futuristic novel, but this is real life, and we're witnessing this amazing merger between the human brain and cutting-edge technology right in front of our eyes. However, developing this new technology isn't a walk in the park, and a handful of these companies that are pioneering this area are up against a mountain of challenges. If a product launched today, it would be like the original Macintosh of brain tech. It works, sure, but it's clunky. The massive potential lies in what comes next. But in order to do this, these companies have to tap into the most complex organ in the human body, the brain. And right now, the priority is to establish a clean, uninterrupted flow of data from the brain to a computer. However, with the brain being so complex, we have to decode the massive amounts of brain data being gathered to get a clean flow. And that requires the help of some of the most sophisticated technology the world has ever known. This video is brought to you by Timeline Nutrition, but more on that a little later. You see, neurotechnology isn't something that just popped up recently. It's been in the academic phase for decades, but it wasn't until 2013 when the Brain Initiative pumped a ton of money into the industry to help ramp up development. Now, a little over 10 years later, we're seeing products on the verge of hitting the market.
Over the next decade, we're going to start to see commercial entities come in, move technologies from commercial prototypes into full commercial launch of consumer products.
And all that investment into research so far has led to major breakthroughs, even giving us iconic moments like this, when President Obama got to fist bump Nathan Copeland, and Nathan was able to not just fist bump back, but also feel the physical sensation of the fist bump back to his brain. I mean, how amazing is that? Now, these implants are pretty complicated to understand, so think about it this way. Picture your brain as a busy city where all the parts are talking to each other to make sure everything works smoothly. Now, imagine if some parts of the city stopped talking to each other, like if the traffic lights stopped working or the phone lines went down. That's where BCIs come in. It's like a super smart Bob the Builder that comes into the brain city to fix these communication problems. It's a tiny device ranging from the size of a penny to the size of a grain of rice. This chip then sends out signals that help different parts of the brain talk to each other better. For example, take Nathan fist bumping President Obama. Nathan had a car accident in 2004 that left him paralyzed from the chest down, but with the help of a BCI, the communication between the brain and the limbs can start to be restored and reconnected. Let's get back to the companies that are pioneering this field. Each is currently forging its own path into this new brain tech frontier. And usually people like to categorize these companies by how invasive the device is, aka how far into the brain it goes. But to really get a handle on where each company stands in the industry, you've got to look at the problems they're trying to solve. Regardless of how invasive the product is, the industry splits into two subcategories and main areas of focus: communication and therapeutic. This split is super important, and it'll make more sense as we dive deeper. So on the communication side, you've got the big names that you often hear about, like Neuralink and BlackRock Neurotech. These companies are working on translating brain activity into movement or speech. They're all about helping the brain communicate in some way, whether it's turning thoughts into mouse clicks or helping a hand move again. Then you have the therapeutic side. You have companies like Motif or Synchron that are focused on writing information into the brain to treat neurological disorders like epilepsy or Alzheimer's. These two are totally different approaches, but both are groundbreaking in their potential medical applications. So how are we using brain implants right now?
We implanted a BlackRock Neurotech Neuroport or Utah array into the M1 motor cortex area of my brain.
I was lucky enough to speak with Ian Burkhart, one of the first people to receive a BCI back in 2014 after a car accident left him paralyzed. Researchers were able to pick up on when Ian was thinking about moving his individual fingers or his whole hand and wrist. That information was then fed into electronic stimulators that would allow him to move his hand and fingers again.
And we were able to do individual finger movements and play Guitar Hero.
This is just the tip of the iceberg for BCIs. Their potential stretches far beyond that. Imagine being able to restore motor functions to any part of the body, or having your thoughts transformed directly into spoken words or text. And that's just on the communication side. There's a whole other Pandora's box to be opened on the therapeutic side. We're talking about using this to combat depression, PTSD, epilepsy, Parkinson's, Alzheimer's, chronic pain, and even ADHD. However, before these technologies can reach the market and the people who need them most, companies still need to address several critical concerns and overcome significant obstacles, like the regulation process through the FDA.
They will be the first to admit that they are understaffed and do not yet have the expertise, especially on the brain-computer interface side, to be regulating these in a way that is at least efficient. This process also just takes a long time because the FDA, for most medical devices that they'll evaluate, is they try to find a similar analog. What can we compare this to?
And one of the first places the FDA turned to were pacemakers, which, for context, were invented around the 1960s. However, because BCIs have such massive potential, the FDA needed a way to quickly bring this technology to people who needed it most. And as a result, they created what's known as a breakthrough device designation. The idea is to speed up these innovations to get them to patients who need them by giving these devices priority attention from regulators.
ALS is extraordinarily debilitating. And so because they are in such a dire state, the FDA will fast-track devices that are being built for those individuals and lessen a lot of the regulatory hurdles that they have to go through.
However, this expedited pathway is not a magic bullet. The reality is the FDA's capacity can sometimes stretch thin while trying to make sure this new tech is both safe and effective. Another major hurdle, and what this really boils down to, is who's going to pay for these devices if they do become available?
It's not a life-sustaining device, it's a life-improving device. How much does insurance really care if I'm able to move my fingers on my right hand like I was able to with the research study versus not being able to?
And because these are medical devices, insurance should cover the majority of the cost. But for insurance companies, the question will be, what's the cost to them?
And that is something that we don't know the answer to. We know the cost to the system for people who have treatment-resistant depression over the course of a patient's lifetime, over $2 million. So I think there's plenty of room to commercialize with sufficient margins to support the product development.
However, there does seem to be a path forward, one that could break this industry into the mainstream, and it's the reason why these companies are distinguishing their BCIs into the therapeutic and communication categories.
I think the path to market is a little bit easier on the therapeutic side. We are already treating people for conditions like mental health using other technologies, similar technologies, and it may not necessarily be implanted.
Now, we still haven't gotten to the one technological aspect of these brain chips that will be game-changing. AI. Yes, AI. I know, but this could change the course of human evolution.
What we're going to find is that as we understand how the brain is behaving in response to therapies, we're going to be able to stimulate brain activity in even more effective ways. So your medicine is going to get better over time the more you use it and the more other people use it.
Remember when I mentioned the industry's current goal is to ensue a smooth, continuous stream of data from the brain to a computer? Well, AI is essentially the middleman here. Sure, we have the technology to capture brain activity, but it's the language models that make sense of the data. And believe me, we're not just talking about a trickle of information. We're dealing with an overwhelming Noah's Ark level flood of data that needs to be decoded constantly. But the other thing the brain does that most people don't know is that it's constantly updating its algorithm. So the algorithm to move your right hand might stay the same for a few days, but then your brain tweaks it a bit. And this is where AI comes into play. It can help adjust your device to match the new algorithm to continue communicating with your right hand. So for companies to get to market, it'll be more of a twofold effect. Therapeutic side followed by the communication side. But the question is, how much room is there for all these companies once the market is achieved?
I see this industry more on the trajectory of pharmaceuticals. You have major players, multi-billion-dollar companies, but they specialize in particular therapeutic areas. I see the same thing happening in neurotechnology. You can imagine a whole ecosystem of therapeutic BCI and neurotechnology companies emerge.
Okay, so I gotta ask, outside of medical benefits, what other wild use cases have you seen or heard of that we could see BCIs used for in the future?
There was some research that was piloted to see if someone could control an F-22 fighter jet simulator, and that was quite successful. I know that there's also been cognitive enhancement devices that the military has been working on to help soldiers react faster on a battlefield and also be calmer.
We use neurotechnology to kind of right into my peripheral nervous system and my muscles, a golf swing. You take a step kind of further, I've seen people control multiple devices at the same time. In the memory domain, person A form and recalls a memory. Person B uses a neurotechnology that has kind of the memory from person A. They can recall the thing that person A saw.
So it's not just Alzheimer's or ADHD that these devices can fix, but I can download Tiger Woods' golf swing directly into my muscle memory or pilot an F-22 with just my thoughts. I genuinely believe that BCIs will alter the course of humanity. Yes, there are darker sides to this technology, and the ethical concerns are huge. However, the possibilities BCIs offer are nothing short of amazing, enabling us to push the boundaries of what's humanly possible. We're in for a pretty wild ride. So as cool as brain-computer interfaces are, it's not something everyone can get their hands on right now. But something everyone can is MitoPure. You see, aging starts earlier than you might think, and it starts right in our cells. By the time we hit our 30s, like I just did, our mitochondria, those tiny powerhouses in our cells, start to slow down, leading to less energy and making everything feel a bit harder. This energy dip affects not just our physical strength, but also our quality of life. Everyday activities and hobbies become a little bit tougher. But what if there was a way to fix that from the inside out? Well, that's what MitoPure does. It gets to the root of the problem by energizing the cells. This means more muscle strength and endurance without changing your exercise routine. And we all know the supplement market is full of wild claims. It's tough to know what's legit and what's just hype. So how do you create something that can be trusted and actually works? You spend 15 years doing rigorous scientific research and human clinical trials like Timeline did. When you choose MitoPure, you're not just buying another supplement. You're investing into something with real scientific backed results. Invest in yourself by visiting the link in the description.